step back, and I mean, obviously, you are one of the world expert and medical oncologists in dealing with advanced stage melanomas, and not every patient will have access to you. What is it like when the patient come to your office to talk about, treatment? And let's start with a patient that has, let's say, stage 4 disease. How would you walk them through that process?
Yeah. Well, first of all, it's a, privilege obviously to be able to care for patients, and we recognize we're meeting them at a really difficult time. No one really wants to be in my office, even if we're nice and we'll have a wonderful team and a wonderful staff and great resources here. We recognize that this is usually the last place anyone wants to be. With melanoma, many of our patients had a previous diagnosis
Sure.
of melanoma, so it's something that maybe has been on their mind or something that they've been worried about. But it's always really scary to get that news. And I think I really just reflect back on how much my practice has changed, over the past 10 plus years that I've been practicing, just with the advances now, that I think it's important to convey that even though it's a scary time, there is that hope because of the therapies that we have. But we start just like any other, office. We get to know the patient, we review their records, we learn a little, bit about them, how they've been feeling, and all of those things. We kind of start to piece together a treatment plan for them.